Hi everybody, James here again from Malloy's Pharmacies, and one of the questions we often get asked a lot about is cholesterol. And one of the most important things about cholesterol is it's very important in cell function within the body and also in the use of production of hormones. But if you get too much cholesterol in your body over a period of time, that can lead to the generation of plaques within your bloodstream, and these plaques can then block up different blood vessels, and that can lead to a lot of serious consequences. So we have to be very aware of what cholesterol does and how important it is to manage it, because with cholesterol it comes on you, the actual effects of it, very quickly. You know, you could end up with a heart attack, you could end up with a stroke, and the only way you can actually spot this is with an actual blood test. So usually, say in Europe, what we try and do is get our cholesterol, our total cholesterol, down below 5.2. And it is so important to look at diet is very important. Exercise is really important. And as well as that, there are really good tablets out there nowadays that you can get on prescription. For example, Lipitor would be one that are very effective in lowering down your total cholesterol levels. There are different subtypes of cholesterol called LDL and HDL, but we won't go into that today because it can complicate things. But just to say, if we look at our diet, very important. If we look at exercise, very important. A couple of supplements as well that are very important. Omega-3 is quite good, and there's a product called Geraghty, which is a plant sterol, which has been shown to reduce down cholesterol quite effectively, and red yeast rice as well. And these can be used along with your prescription only medicine, or they can be used on their own as well. But in relation to that, make sure over a period of time that you go to your doctor, you get your blood test done, and make sure that your cholesterol is in around that 5.2. It's also important to note that sometimes cholesterol can be quite high because of genetic purposes or genetic predisposition towards that, and if that's the case, the GP would be well able to manage that. So thank you for that. I hope we've covered a couple of points there around cholesterol. Any other questions that you may need, put them on our platform, and thanks again for looking in.